For you, the maker of a certain type of breast implant has issued a worldwide recall this past week for a certain textured model of a breast implant after the FDA alerted the company that it was concerned about heightened cancer risks. So, here to talk more about this health alert, we invited Dr. Reza Zadrian from Zadrian Plastic Surgery in La Jolla here in studio. Good morning to you, Doctor.
Good morning. Thank you.
Very, very important health story here. I know affecting so many women. Let's talk about this recall.
Sure.
What breast implant maker was it that issued this recall?
So this is for Allergan BioCell textured implants. It's a very specific type of implant with a textured surface. Altogether, textured implants make up about only 10% of the implants that we as surgeons use, and Allergan's comprises about 5%.
Okay, so if you would know if you should know what type of implant you have based on your plastic surgery.
And if patients don't, they generally just get in touch with their surgeon to find out what type of implant was used. Yes.
Okay, and what seems to be the concern with this specific breast implant maker? Because it's the textured breast implant, correct? And the textured breast implants, that type of model has been around for quite a while now.
It has been. Although most of us tend to use the smooth implants, not the ones that have the textured surface, but it has been around for a while. Probably over hundreds of thousands of women in this country actually have them. Around 2011, there was a link that was noted between a rare type of lymphoma with these types of implants, the textured implants, and more recently the number has increased. Up to now we have 573 cases, including 33 deaths. So based on that, the FDA recommended, and Allergan, the manufacturer, elected to remove these implants worldwide.
Now that you have a couple of implants that you're holding, which ones are these?
These are actually the smooth implants. These are not textured, and we continue to use these all the time. And in fact, in my practice, I've used this almost entirely in my 20 years of practice. The textured ones are similar, but the surface is actually processed differently. And the thought is that perhaps the texture surface has some kind of inflammatory reaction, and that maybe is what is causing this particular illness.
Okay, I see. And the reason why one would possibly choose a textured implant versus a smoother one like this, what are some of the reasons?
Well, the thought was that they actually create less scar tissue when we place them in the tissue, as well as possibly less movement of the implant.
I guess it's important to point out that it's not all textured implants that are being recalled. It's specifically the ones made by Allergan, correct?
Correct.
Okay.
There are a lot of different manufacturers, and they haven't actually done anything about it. The recent cases proved to be more than like 80% were actually related to Allergan's BioCell type of textured implant.
Okay.
So that's why the FDA recommended.
Okay,
Yes.
and it's a voluntary recall at this point, correct?
Correct.
So, when you are going in for a consultation, when we come in to see you, for example, doctor, does the patient have a say as to what type of implant the patient wants? Do you recommend the type of implant? What would work better?
Yeah, I mean, the most important thing is the education part of it to make sure that they understand what they're kind of getting into. The surface itself, like I was saying, most of us use the smooth surface implants, but patients have a choice of using saline implants or silicone implants. The material that actually fills the implant itself, it's totally the patient's choice what they use. There are different styles of implants. There are obviously different sizes of implants. Those are all things that we discuss with patients so that they can make the right choice for themselves.
Very good. And lastly, as we wrap here, doctor, what would you suggest for folks out there who perhaps have the textured implants made by this particular breast implant maker, Allergan?
Sure. So it's important to know that the FDA is not recommending people remove these implants if they don't have symptoms. So the most important thing is for patients to actually get in touch with their surgeon, have an examination, have an evaluation, particularly if they are having some symptoms. Most commonly, the symptoms are swelling. Sometimes it increases the size, even twice the size of a normal breast. There may be some fluid around the implants. This particular lymphoma is really limited. It's not a breast cancer. It's actually a lymphoma a cancer of the immune system that actually is formed around the scar tissue of the implant. So in most cases, the treatment is to actually remove the scar and the implant.
Very, very important to clear that up for us. Thank you so much, Dr. Reza Sadrian from Sadrian Plastic Surgery in La Jolla. We appreciate your time on an early Sunday morning.
Thank you so much. My pleasure.
Okay, have a great day, and we will be back with much more here on Good Morning San Diego.